Hello and welcome to my presentation on American Trypanosomiasis, kissing bugs, and climate change. The defined research question for this presentation is: does climate change have the ability to cause an endemic of American Trypanosomiasis, also known as Chagas disease, by allowing habitable territory of the disease's vector, the kissing bug, to increase in continental United States? Before beginning this presentation, I'd like to introduce you to some basic morphology of the disease's vector, the kissing bug. It is a member of the order Hemiptera, the family Reduvidae, and subfamily Triotominae. Their legs are cursorial, which are used to run. Their antennae are filiform and bent at the ends, and their mouth parts are piercing and sucking. Their metamorphosis is hemimetabolous, which means they go through instar phases before reaching their adult form, and their forewings are tegmina and hindwings are membranous. So what exactly is American Trypanosomiasis, and why should you care? American Trypanosomiasis, also known as Chagas disease, is a parasitic disease transmitted by the parasite Trypanosoma cruzi, which is found in all members of the subfamily Triotominae, also known as kissing bugs. Transmission of the parasite is primarily through kissing bug's frass or its excretion. All members of the subfamily Triotominae feed on vertebrates' blood, and because of this, when feeding occurs, the kissing bug will leave behind its frass or excretions on the organism, which allows the parasite to crawl into the opening on the organism's skin and be passed through its circulatory system and infecting the organism that the kissing bug has been feeding on. Chagas disease is currently categorized as a neglected tropical disease by the World Health Organization, one of 17. Chagas disease is able to be treated and managed with antibiotics and other treatments. Main symptoms of the disease include swelling, fever, headache, rash, and pain in the patient's abdomens and musculoskeletal systems. If a person contracts Chagas disease and it goes undiagnosed and untreated, it does have the potential to be lethal, causing congestive heart failure in those that are undiagnosed and untreated. Current methods of treatment is just therapeutics. There is no known cure or vaccine for this disease. The absence of one can be attributed to a lack of research of the disease, and this is why it is categorized as a neglected tropical disease by the World Health Organization. So where exactly is Chagas disease commonly found? Right now, it is most commonly found in Latin America, where it is considered an endemic. The figure on the right of the slide shows where the disease is currently considered an endemic within Latin American countries. The likelihood of contracting the parasite and the disease is typically associated with the socioeconomic status of the patient. We typically see low-income families and patients being more likely to contract the disease because they are not able to afford the living situations and resources to properly mitigate the spread and exposure of the kissing bug and the parasite itself. Chagas disease is typically found in less populous areas and can be associated with the kissing bug's habitats being in these less populated areas. Kissing bugs and the parasite Trypanosoma cruzi are now being found in the southern continental United States. This is a result of two things. The first being Latin Americans that are migrating to continental United States are unaware that they've contracted the parasite or the disease is undiagnosed. The second is climate change, which has continued to increase habitable territories of the kissing bugs in the southern continental United States, driving their range further north. So what kind of relationship has been observed between climate change and the kissing bug? For the kissing bug, it has been a relatively positive one. They have found that their habitable territory has continued to increase due to worsening climate change. A study led by Carlos Ibarra Cerdeña studied the relationship between the niche conservatism hypothesis and kissing bugs. This hypothesis states that related species diverge into niche characteristics at lower rates than expected. His study concluded that kissing bugs are able to evolve at faster rates than have been expected, and changing ecological niches and changing climates are able to exploit these because of climate change. Another study, led by Maureen LaRoche, investigated the ability for Bartonella bacterium cells found in the kissing bug to mutate and adapt. This study found that this bacterium has been able to adapt and mutate to changing climate, and this conclusion can draw comparisons to the parasite that causes Chagas disease, Trypanosoma cruzi, and its ability to mutate and have elevated fitness in response to climate change. And because of this, we can draw comparisons between this parasite and other viruses and bacteria, such as coronavirus, that are able to mutate and have success. Drawing more into the commonalities that Chagas disease could experience with COVID-19, I would like to make you aware of its potential to spread in the continental U.S. The continental U.S. has already been through a Chagas disease endemic. This occurred in the year 1899. The figure on the right shows cities and areas in the United States where this was localized. We have not seen a magnitude of a public health crisis in the United States like COVID-19 since the Spanish flu of 1918. With climate change worsening and habitable areas of the kissing bugs continue to increase, there could be a potential for Chagas disease to reemerge and cause another endemic in the United States, just like it did in 1899. There are a couple of points I would like you to take away from this presentation. One of them being that climate change has many unforeseen consequences in the near future and that we have not anticipated. Although there has been plenty of research conducted on the potential impacts of climate change, there are things that we have not accounted for, such as the spread of Chagas disease. The spread of Chagas disease has the potential to be another public health crisis like COVID-19, and this is an unforeseen consequence of climate change that needs to be communicated to more people. Another takeaway from this presentation is that climate change is typically associated with destruction of habitable areas for some species, but this is not always the case, like for the kissing bug. As we have seen through this presentation, habitable territory for the Chagas disease's vector will continue to increase because of climate change. And lastly, I hope you are educated on Chagas disease itself and its potential. We should draw enough attention to Chagas disease that it is no longer considered one of 17 neglected tropical diseases, and that medical companies are actively pursuing vaccines and more therapeutics to help treat and manage this disease. Chagas disease should not be taken lightly, and it has the potential to reach endemic levels like it already has in the past. The ability for the disease to spread will only continue as climate change worsens.